If you had told me a year ago that this was a video I'd be making, I would have probably called you insane, because talking about my health is such a struggle, and sharing everything I've gone through, especially with all the discrimination and fragility directed at chronically ill and disabled people, has been a very, very hard thing to deal with, and yet here I am. So for my past several videos in my vlog series, hey buddy, hey baby boy, hey Mochi. If you had told me a year ago, I would not believe that I'd be sharing this, but in my past vlog series, I have been discussing my health a lot, so I figured I owe it to you to at least explain what's been going on, because it's a little hard to understand what's going on if you don't know it. This is not to make you feel sorry for me or to try to pray the devil out of me. Believe me, that has happened. Or to tell me I don't deserve to live. I'm sure that there will be that one person in the comments section who feels the need to say something like this. So I am saying now, please don't. Please try your best to be a kind person. I don't know what motivates people to say such unkind things to others, but it's clearly something. So if you are that person, just think before you comment, okay? And if you do comment that, you will be blocked. So that being said, I do realize a lot of people don't know that what they're saying or doing is ableist, because benevolent ableism in particular is not something that a lot of people learn about. Anyways, this is my health history broken down. It's not exactly linear because the symptoms kind of overlap with my different conditions, but I'm going to start as best as I can. So when I was a little girl, I started having these obsessive thoughts. You form memories around the age of 3. And for as long as I can remember, assuming around the age of 3, I had these fears. These fears that I was being hateful to other people, that I was racist, that I was sexist, that I was homophobic. And then I would have these thoughts in my head of violent things happening to me and then violent things happening to other people. And these fears and these images that I would be raped or killed. And that's a really hard thing to talk about, because for people with OCD, we really fear these thoughts and we genuinely believe that we're bad people for thinking of them, even though it's caused by a lack of serotonin in the brain. So I would have these thoughts, and to compensate for them, I would do these different actions. I went through a phase where I had to tap all of my teeth. I went through a lot of teeth-related phases. I had to tap all of my teeth to make sure they didn't fall out, and it got to the point where my teeth were actually hurting. I had a lot of fears that I was developing some sort of disease when I was younger, which obviously made it harder later in life for people to take me seriously when I was having symptoms. But of course, I turned out to be chronically ill. But this was before that. So I was having these thoughts and these fears and these anxiety disorders, and I couldn't fall asleep at night. So I was lucky enough for my parents to take me to a therapist. She's no longer my therapist, having retired from her practice this past fall, but I have a new therapist. Both of my therapists are the loveliest people, and I'm really grateful for them. So my first therapist, Miss Meg, she saw me and gave me this book called The Turnaround Journal, which is essentially a guided activity book for retraining your brain. And for the longest time, this worked really well. Later on, I ended up developing more severe issues for my OCD, but at the time, it worked decently well. I was still having my compulsions. If you don't know what the compulsions are, a lot of people don't see obsessions. Some people have primarily obsessive OCD, which they just have the thoughts, but basically, to describe it the best way I know how to, OCD is sort of like your brain is a conveyor belt and the thoughts are flowing down the conveyor belt, and while the average person would see one of those thoughts as a fear, like, ooh, if I'm going on an airplane, I could get COVID, they would just dismiss that thought. A person with OCD's brain fixates on that, and that's all they can do all day and all night. So if that's what you're afraid of, your body starts doing things to compensate with that. It could be hoarding. In my case, I had contamination and order and symmetry OCD, so the typical kind with cleaning. A lot of my fears were germ-related, but most people do have hoarding OCD or checking OCD. They have to flip the light switch a certain amount of times, have to do a little ritual before you can leave your house every day. As I said, mine were textbook OCD compulsions, but you don't actually see that very frequently. And that's really all OCD is. It's the lack of serotonin in your brain making you fixate on that one thought and all the things you have to do to prevent that thing from coming true. Which, again, we'll get to later. So, in 2nd grade, I started getting these little bumps on my hand. You can see where I got one removed the other day. And I didn't know what they were. My mom just said they were skin tags, but they seemed to be spreading. We later found out that those were flat warts. And if you look up warts, you're going to see these photos of these darkly colored things on people's skin with a little black dot in the middle. The black dot is actually not a seed, as people call it. It's a blood clot. When a wart comes close to dying, it develops a blood clot. So digging the seed out or the blood clot out is not actually going to do anything. I know a lot of people think that, though. But these had no blood clot. They were just the same color as the rest of my skin, but they were tiny little lumps. So obviously we didn't assume warts. When I went to see a dermatologist for my acne, which I have, I asked her to look at these things that were on my hands, even though everyone else told me not to worry about them, and she revealed that they were little flat warts from immunosuppression, which brings me to my next topic. When I was in 5th grade, and this is really when my disability started developing, and this will discuss bowel movements, so if you're triggered by that, don't watch this part. December of 2021, my bowel movements started becoming looser. We have a thing called the Bristol Stool Scale, which we use to measure fecal consistency, and with 1 being the hardest and 7 being the most liquidy, and I was at about a 7, but I just kind of dismissed it as, oh, maybe I have a little virus. I don't know, because it was COVID. We were all isolated. Flash forward to Martin Luther King Day, 2022. I ate a bunch of tomatoes, which we later found out did not agree with my stomach, but we didn't know at the time. And my stomach got a lot worse. I was using the bathroom 20 times a day, maybe, which was not that bad, but you don't want to pass stools 20 times a day, obviously, especially if they're liquidy, because that can lead to dehydration, which I developed, even though I drink a ridiculous amount of water. About a week later, I used the bathroom, and there was blood in my poop. And it was in that moment that I knew something very, very serious was wrong. So I told my dad. We were trying to get in with a pediatrician, which was obviously hard during COVID. COVID was still rampant in 2022. And we finally got in with the pediatrician, who had me create a log of all of my stool movements and everything that was going on. And he just said, oh, you have IBS, or irritable bowel syndrome. You're probably going to develop constipation as well. Sometimes there's just a little blood with the switch, but I knew deep down that's not what I had, because this wasn't a little blood. My stools were all blood. No stool, just all blood at this point, and I knew something really, really bad was happening. But I got tested for all of these infections. I didn't have an infection. And it was about this time that at school I started using the bathroom and having accidents, which is something that people with the condition I have experience a lot, and it can be very embarrassing and very isolating. So every day after lunch, I would have an accident, and I just had to start staying home because it wasn't something that I could continue doing at school. We met a gastroenterologist who, the first time she met me, heard my symptoms and said, you have ulcerative colitis. If you don't know what ulcerative colitis is, because most people don't, it's a form of IBD. Now, IBS, as I mentioned, is irritable bowel syndrome. IBD is inflammatory bowel disease. I have both. The IBS was caused by the IBD. We'll get to that later. But the IBD, I promise you, as someone with a very severe case of both, is way worse. Whereas IBS is a brain-gut miscommunication, IBD is a condition where the intestine senses some kind of threat. It's normally a valid threat, like a disease, and when it kills the disease, it's looking for other things to attack, so it starts to kill itself. So it swells up. And then in one of the forms of IBD, Crohn's disease, which takes place in the small intestine and occurs over a longer period of time, the walls thicken of the walls of the small intestine. And then with ulcerative colitis, yes, the walls become inflamed, but you develop these bloody ulcers and pseudo polyps in your intestine, which accounts for the bloody stools. And I was really surprised that just by hearing my symptoms in 2 minutes, she could automatically say that, just with the onset and how quickly I had deteriorated health-wise. But she said she needed to give me a colonoscopy just in case. I was terrified out of my mind because even though he still has not had one, and he is almost 60, my dad always said that he dreaded most getting a colonoscopy in life, so all I had heard was, oh my god, these things are going to be terrible. And I had never had surgery before, and she mentioned that they would have to take little biopsies. Colonoscopy is not really surgery, but it just depends on how you look at it. And so they went down, they took a bunch of my blood. When you have IBD, ulcerative colitis, Crohn's disease, they look for something called your C-reactive protein, which measures the level of inflammation in your body system. My C-reactive protein was about a 500. It should be a 10 or below. 500 was not my worst, believe me. So she gave me my, on Valentine's Day, I had my colonoscopy after fasting and full liquid diet and clear liquid diet and having to take all of these laxatives. Colonoscopies are, and I say this without a doubt, the one thing that does not get better every time you have to do them. You learn how to cope with them, but it doesn't get any better. So I had my colonoscopy. She said, yes, you have ulcerative colitis, but you have a very mild case. And so she put me on Pentasa, which is the form of the first line treatment, otherwise known as mesalamine, for ulcerative colitis. With ulcerative colitis, you take mesalamine as the first line treatment. Then in the middle, they have immunomodulators, which were the first treatment developed other than a colectomy, which is end of the line. But immunomodulators work very slowly. Then above that, you have biologics, which you probably know most commonly as an infusion for arthritis. So Remicade, Entyvio, Stelara, Skyrizi, those are most commonly treatments for arthritis, but you use them as IBD treatments too, and they are typically injected or infused. Now, at the time, as this was in 2022, they were doing a testing of another kind of medications called JAK inhibitors, which were as strong as, a bit stronger than biologics, but they hadn't been approved at the time. It will be important later in my story, though. So she just mentioned the mesalamine, the immunomodulators, the biologics. I was on this mesalamine, Pentasa, went back to school, but things weren't getting better. My symptoms were getting worse. I started using the bathroom about 50 times a day. So she added a steroid called prednisone. Steroids, we later found out, don't work for me unless they're given via IV, and I only get the bad side effects if I take them orally, so I don't do steroids anymore. But I was on this prednisone, and it wasn't making things any better. By this point, I was, my stools were all blood about 100 times a day, 100 times a night. I'm not joking. I'm serious. I never left the bathroom, and then I started throwing up every time I used the bathroom as well. So my body could not take my medicine anymore. I didn't know how to swallow pills at that point, so they were opening the capsules and having me eat yogurt. I couldn't eat anything. I couldn't drink a sip of water without throwing up, which was really, really intense. I finally learned how to swallow pills. I swallowed the nausea meds, and then I could swallow all of my pills, but I was still throwing them up because my body was not in a good place. One weekend, about 2 weeks before my birthday, my 11th birthday, we were talking to my GI doctor. This was while I was at home using the bathroom, throwing up all day. And she wasn't on call, so the other GI doctor, at the time, there were only 3, there's a 4th one now, was on call. And he said, you need to take her to the hospital. She needs to get fluids. She needs to get treatment. Her body is not okay. So they took me into the ER where they started giving me IV fluids. They gave me the steroids via IV. And at this point, I hadn't eaten food in about a week or drunk water in 3 days, which is the longest your body can go without those things. So they gave me fluids. I didn't eat food for another few days. They finally cleared me for clear liquids, except for things that are red, orange, or purple, which kind of eliminates a lot, just because if you get a colonoscopy, those things can be mistaken for blood. and I was getting these steroid infusions. I got better, went home for 2 days. I had started eating food again at that point. On the second day, well, my symptoms came back even worse than before, all the way back to the 100 bowel movements a day, puking, all of that stuff. And my parents were really scared because, I had just gotten out of the hospital. This time they took me back into the ER, and my doctor decided that the steroids, seeing as they only worked via IV, I needed a much stronger treatment, and the immunomodulators wouldn't work fast enough, so she put me on what was, at that time, the end of the line treatment, excluding surgery and trial antibiotic salvage therapy, and I went on a biologic called Remicade, which is pretty common for rheumatoid arthritis. I got my first infusion on my birthday in the hospital, my 11th birthday. I think that's the best birthday gift I've ever had. I mean, my symptoms were still really terrible, and it took a while for the Remicade to work. But just knowing that I got this treatment that put me in remission for about a year was pretty amazing. I left the hospital when the infusion started working. I was still on the steroids at the time. We tapered off the steroids, so 40 milligrams twice a day, then 30, then 20, then 10, then 5. And I started getting the infusions every 2 weeks, and then we were able to taper down those 2 to 4 weeks, and then 8 weeks, which is the maintenance dose. And then about a year later, they switched me to the cheaper version called Inflectra because my insurance didn't want to have to pay for Remicade anymore, which at the time is not nearly as expensive as what I'm on now. Treatment really needs to be lowered, even as someone who's as fortunate as I am to have, the access to the medication that she has. It's still very difficult. But around this time, I started having this sensation of fire ants crawling through my skin, biting me. That's the only way I know how to describe it. And every time I touched my skin, it doesn't happen now, but every time I touched it, this welt would form. So I saw an allergist who said what I had was called chronic idiopathic urticaria, or lifelong hives that occur at spontaneous moments, triggered by an allergy to one's own skin. And the lumps on my skin were dermatographia. But the reason, dermatographia is a condition where you can draw on your skin. You've probably seen photos of it. It's not as cool as it looks. The reason I was not getting the classic hives associated with chronic idiopathic urticaria is because my Remicade, which is an immunosuppressant, because ulcerative colitis is an autoimmune disease, was suppressing the hives, but it wasn't suppressing the symptoms. So he put me on a really high dose of antihistamines, Zyrtec, you've heard of hydroxyzine, that made me too sleepy, Singulair, that made me depressed, Pepcid, I was already on Pepcid for my GI system, but it's actually an antihistamine as well as an antacid, which you would never know. And I later went on one called Doxepin too, and then that wasn't helping, so he told me they have these shots called Xolair, which are now used for peanut allergies, but they were invented for CIU. These shots were very painful, admittedly, not complaining, just being honest, because the medication is very viscous and the needle is quite thick. So I was on those shots for a while. I ended up going off of them, but now I'm back on them and they work beautifully. The shots might be painful. They later made it into one shot, which is way better. And the shot might still be painful, but it's so worth it because my CIU is really well controlled and I'm really grateful for that. Around the time the CIU was getting under control, last day of spring break actually, spring break, 6th grade, I was standing at the place we were staying for spring break, ready to leave, and the room started spinning, and this hand seized up, and it started shaking. I'm double jointed, but I can't really do it unless you've seen it. And my parents just said, oh, okay, she's probably dizzy, she needs some water, and I thought, all right, that's it. But then this kept happening, but only in this hand, and it was really weird. And then I would have these things in the middle of the night where I would wake up, this would start seizing, I'd hear a ringing in my ears, and then my whole body would seize up. And so the next morning I told my parents, hey, I had a seizure, but I was just like, maybe it's just a dream, it's probably just a dream. I'm probably not having seizures. But this started happening more frequently. I wasn't sleeping because every night I was having multiple seizures. And one morning after a night of seizures, they took me into the ER where they just said it was medication interaction. Saw a neurologist who was unfortunately not a very helpful doctor. I have overall, though, been blessed with great medical care. And so the seizures continued. One morning, I had not slept at all because of the seizures. My mom said, hey, okay, just to placate me, I will stay and watch you while you try to get a little more sleep. And I did. She was snuggling me, my hands seized up, and she said, oh wow, that's really spasming, which is what I had been trying to tell her. Then I told her I couldn't breathe because every time I have a seizure, my throat closes up and I hear this ringing in my ears. And she said I was just having a panic attack, but then she called 911, and when my eyes rolled back in my head, she realized that I was right. I was having seizures. So they took me in, put me on life support. I had gone into a coma because when you have prolonged seizures that last more than 10 minutes, your brain starts to swell and your body puts itself into a coma so that your brain doesn't swell too far and you don't go into what's called status epilepticus, which is basically a really severe form of epilepsy. So I was in the hospital in this coma. While I was there, I had all these tubes in my body, breathing, oxygen, tube to suck the food out of my stomach, just in case I didn't get it stuck in my throat. And they tested me for a brain tumor because that's normally the first thing they test for. Thank goodness I did not have that. They slowly weaned me off the sedatives because while I was already in a coma, my body was still having a seizure, so they added sedatives to prolong the natural coma. And I didn't immediately wake up because I was still in a natural coma, even without the sedatives. But when I did, I had, if you've ever seen Stranger Things, the things in my hair, they don't actually have to shave your head for that. I've been asked that a lot, but that's not, they don't do that. I woke up, they said, hey, you've been having seizures. And we went and we saw another neurologist, this one who was amazing, who told me I needed to get a spinal tap, which is, I don't know how to describe it. It's very painful, but it's sort of a procedure when they take this little box with a needle on it and they hammer it into your spinal column. Unfortunately, I was awake for that. They told me I could be sedated, but I wasn't. The procedure went wrong, so they had to redo it. Anyways, the bottom line is that I did not have any infections of the spinal fluid. Why can I not speak today? Which meant that the only other solution was epilepsy. Epilepsy is not really a real diagnosis. I mean, it is, but it's seizures that have no other cause. So if you don't have a brain tumor or a spinal fluid infection, they just say you have epilepsy. While I was in the hospital, they had put me on this one medication for it, Keppra, and it worked well enough, but then 1 month later, I had another seizure that began in this hand because my seizures were focal. So focal is when this hand seized up, this half of my brain, all of the neurons were firing at once. And then when your body has a full seizure, a tonic-clonic seizure, it means all of the neurons in all of your brain were firing at once. So mine start out as focal and become tonic-clonic. I had one, and the Keppra worked well enough that I didn't lose my sense of hearing, but I still couldn't speak or move. And I had my parents, they heard me screaming before I lost my ability to speak. They came in the room, and the neurologist had given them a medication they could give me, but they had to wait 5 minutes first to see if I would snap out of it. That was the most traumatizing thing that I think has ever happened to me, just trying to tell them to give me the medication because I was so freaked out. Seizures don't hurt, they're just really scary. But after the 5 minutes, I was still in one. They gave it to me. At which point, the neurologist put me on a medication called Vimpat in addition to the Keppra, which controlled the focal seizures so that they couldn't start in this half of my brain and thus become tonic-clonic. And I've been on both of those. And other than the occasional focal seizure, my epilepsy has been really, really well controlled, which I'm also super grateful for. You know, it sometimes gets worse based upon my ulcerative colitis, but my UC has been really the main problem. Even though the one seizure that I had where they were awake, the doctors were, it shouldn't have happened, but for some reason I had enough consciousness to flip myself on my side and I hit my head, but everyone says I saved my own life, and I think that's really, really strange. And I'm not saying that to brag, but yeah, I try not to think about that night too much unless I'm with my therapist. However, when I was in the coma, they gave me antibiotics, which when you have ulcerative colitis, it's not a good thing because it creates GI infections. If you don't know, infections like Salmonella, E. coli, C. diff are not really an outside force. Your gut naturally has all of those bacteria in it. It's just that some of the others will be depleted, and whatever you have, say you have salmonella, the quantity of salmonella bacteria in your gut is higher than the quantity of all of the other bacteria in your gut. And so the antibiotics gave me C. diff. I was on vancomycin for about a month. And then I had to go back to the hospital for my UC because the Remicade had stopped working. It wasn't as bad as my first flare-up because it was still sort of working, but it wasn't working nearly as well. And that was when I got another C. diff infection, for which point they put me on fidaxomicin. Then I got E. coli. Then I got C. diff again. And then my doctor said, oh, maybe you have IBS on top of IBD. So she tried a medication called Bintal and a medication called Colestipol, neither of which worked, unfortunately. Then, as I mentioned earlier, the other category of medication that they were testing, JAK inhibitors, came out. And one of those, Rinvoq, I really wanted to try because it targets the specific inflammation as opposed to just the area. And it's less immune suppressing. The problem with Remicade is it suppresses the whole immune system, which means I got sick very frequently, versus other medications are less immune suppressing. So we were waiting for the Rinvoq to come in. Around this time, my OCD got really bad, and possibly that was due to my health, I don't know. But my germ phobia was so bad that every time my hand brushed the sink when I washed it, I had to wash it again. And combined with all the time I already spent in the bathroom because of having IBD, it was not sustainable. I could not leave my house. I could not have any part of my body, my hands, touch anything. So my therapist just said, after I tried exposure therapy as well, that I needed medication because what she had done was good, but that this was just a problem with the chemicals in my brain. So I went on Prozac. I met a really weird psychiatrist who had me take the Weibach or Yale-Brown obsessive compulsive test. Stopped seeing him because that guy was... Anyways, I was able to go on Prozac. Started at 20 milligrams. Eventually, I'm at 80. I've been on 80 since then, and it's literally been a lifesaver. I mean, not to say I don't still have certain obsessions sometimes, but I'm able to live a healthy life mentally, which is a really, really amazing thing. Maybe not so much physically, but mentally, and that is definitely great because your physical health has a big impact on your mental health. So, oh, hey, buddy. Sorry, my cat, I think, wants out of my room. Never mind. My OCD was well controlled at this point. Apologies, my cat did want out of my room. Sweet, sweet Mochi. However, my GI problems were still rampant, and we didn't quite know what to do about it. So I started Rinvoq. It didn't seem to work, so I stopped Rinvoq. My GI doctor is really into trying things for a long time, which I appreciate. She has a strong will, and I really admire that. So then she put me on something called Entyvio, which is a biologic as well, but again, less immune suppressing. It only suppresses inflammation in the gut and not in the rest of your body. Well, that didn't work either. So she put me back on Remicade. I had also just broken my tailbone, which not a good combination when you have to use the bathroom a lot. Anyway, she put me back on Remicade, and yeah, that didn't work either. So I went back on Entyvio, and they added Rinvoq on top of that, and that seemed to work. So we weaned me off the Entyvio, and then I was just on the Rinvoq. But Rinvoq is a very difficult medication. We had to get it approved because each pill is about $3,000, and I take maybe 100 of those pills a month, and no one has that kind of money. So we applied for a bridge program, and they paid for all of the medication, which is something that I'm really, really thankful for, because the medication has kept my UC decently well controlled. And I got a bit better, but I was still having symptoms. Achy joints come with UC a lot, and I was having that. But they kept testing me, and this had been happening for the whole time. But my colonoscopies were completely clear. My C-reactive protein was low. My stool test showed no sign of inflammation. When you're doing a stool test, they test for the calprotectant level, which shows inflammation. My calprotectant was super low. My C-reactive protein was super low. My colonoscopies had no inflammation. My biopsies showed no inflammation. And they kept testing me, and then they finally said that, yeah, this is not your IBD, it's doing well. And I was really frustrated because this had been going on for about 2 years at the time. So they tested me for all these food allergies, none of which I had. So then they went back to, okay, this is IBS on top of IBD. I tried more of those medications. That didn't work either. So I tried them again. That still didn't work. So this fall, I went into the hospital because my symptoms were really bad again. And they had me try Bentyl again and cholesterol again. And then they just sent me home immediately, which was, they were probably really busy, so I'm just gonna chalk it up to that. Tested my blood and my stools again. They were still normal. So my doctor just went, okay, yeah, you have IBS on top of your ulcerative colitis. I still have ulcerative colitis, but she just said you have IBS instead. I was highly doubting it because none of the IBS medications had worked. So they had me do something called the low FODMAP diet, which you guys remember. They were really hoping the diet would work. It unfortunately did not, but it only works on 50% of IBS patients. So we got a second opinion who said it was my OCD and that it was all in my head. So we got a third opinion. And this third opinion said that what was happening is that between the seizures, the infections, I had gotten another E. coli infection a few months ago, and the ulcerative colitis, the vagal nerve, which is what connects the brain and the gut, was irreparably damaged, and it no longer sent signals, which meant that every time I ingested a bite of food, my brain told the rest of my body that I was being poisoned. So I would use the bathroom, get these violent chills, get a fever, and they tried more medication. One was a Losatron. I'm still on that. That one hadn't worked. We had to give it 2 weeks. It's been 5 weeks. Still hasn't worked. Amitriptyline, which we go up on dosage each week. So I'm currently on 30 milligrams. Unfortunately, amitriptyline has a lot of side effects. So passing out, fainting, those are the same thing. Being very lethargic. It has a lot of side effects and my body didn't tolerate it well, but I'm still going on it. I have to give it another month at this dose. And then he said I could try hypnotherapy, which is the regimen that I'm starting now. And then I would get an implant in my ear that would shock my nerves fairly regularly. And then I could get acupuncture, but beyond that, they don't know what to do because this is the closest thing they have to this is IBS, but the nerve damage is not something they've ever dealt before. So in the past with my conditions, they had treatments for what I had because science had discovered it. Now my health has reached the point where science hasn't yet discovered what I have. So they said that I had chronic fatigue as well, and rigors, which is essentially chronic chills. But they don't have a treatment for either of those. Chronic fatigue, I get 11 hours of sleep a night, so they can't do anything for that. So they're calling this IBS, but in addition to IBD, I still have IBD, but they don't really know a better way to describe it other than that my vagal nerve is damaged. And they still aren't even 1000% sure that's necessarily what's going on. But we've exhausted pretty much all other options at least 3 times over. For the longest time, I thought it was still my UC, but I don't know. Like I said, we've kind of reached the boundaries of science right now. And this has been going on, the current flare-up of symptoms, for about 2 years now. This whole thing has occurred over the past 4 years, maybe, I'd say. All of this, with the exception of the OCD. And while this was happening, beginning of 8th grade, well, summer after 5th grade, I started having this huge thing about controlling my food because my health was out of control. So I thought if I could control my weight and my food, I would be happy. So it started out as something called orthorexia. I'm not sure if YouTube will allow me to say this because it's very finicky about what you can say regarding these body image disorders. And I was throwing my food away every day at summer camp, so I wouldn't eat lunch. I stopped doing that eventually, but summer after 8th grade, it started again. I go to this camp for kids with disabilities every summer, and there I started just eating lettuce and just eating salad, and I did this thing where I would eat what I thought was the healthiest food first and hope that I wouldn't have room for the carbs or the proteins. I started passing out. I remember one day at camp we were learning how to ride a bike, which I was the only person who didn't know how to do that. But I was riding a bike, and then, oh hey buddy, the next thing I knew, I woke up and my knees were bleeding and I had passed out. And they were trying to give me sugar because they said I wasn't dehydrated, but I needed more sugar, and it freaked me out. I couldn't hold things. I couldn't hold a glass of water anymore because I was so weak. So I started seeing a nutritional therapist, who was also the one with the low FODMAP diet, to help me with my, what was eventually called anorexia. I mean, it was never officially diagnosed. It was just sort of anorexic tendencies, but I've gained 30 pounds since I started seeing her, which is a really good thing. I wasn't losing weight, but I wasn't at the weight I needed to be at. And I'm really proud of myself in that regard. It's okay to be proud of yourself and how far you've come. But the GI stuff has still been nonstop for 2 years. I don't know what to do about it, and I don't think anyone does. I wanted a colectomy, which is the removal of the intestine, but that's a really complicated procedure, and we'll go into that later.